Hello and good morning, everybody. Thank you so much for joining our new to CSG app training here today. My name is Anna Patrick. I'm the Director of Strategic Partnerships here at CSG Actuarial, and I get the honor and privilege of being able to train all of our agents underneath the Integrity family on all of the different technology solutions that you have available to you. So whether we're going through CSG, Medicare Center, Lead Center, Plan and Enroll, I always love being able to work with new agents, especially new agents that recently got access to our software, because we have an entire suite of technology solutions available to you that is at no charge. So you are in great hands today. I love being able to show agents the value that this software brings to them. CSG is just one component of the entire technology suite that you have. So I'm really excited to walk you through why you should be using CSG and the value that it can bring to you. CSG is no stranger to the insurance industry. We've been around for quite some time. We were actually the first in the industry to have a Medicare supplement quoting tool, and we have continued to expand our market data, our quoting tools, ancillary products, really to help you be an informed insurance agent. So you'll notice as I'm going through the tool here today that we offer a lot of different quoting, a lot of different carriers, just so you know what you have available to you in the market space. So we're going to go ahead and get started here. I want to let everybody know that we are here to answer your questions too. So if you have any questions, you can always type those questions into the questions box. I will be glancing at that throughout the training and answering questions as they come in, or hold them until the end. We are also recording today's webinar. So if you have to jump off early, I completely understand. You all have busy schedules, so you can always re-watch this. I actually have a lot of agents that join just to listen, and then they watch it again just because we do cover a lot in this new to CSG app training. But just keep in mind that after today's training, we always set it up at the beginning of the month because we'll have additional webinars that we recommend you attend after this one, where we just focus on a couple of different tools instead of focusing on everything in one webinar, because it can be a lot. So I'll let you know where those additional trainings are at, and then some trainings that I think that would be the most beneficial for you to watch if you want to kind of continue your journey down the better understanding the Medicare market and different Medicare trends. So thank you again for everyone's time here today. We've had so many agents register for today's training, which is super exciting to see so many agents wanting to know what they have available to them. So I am just curious to know, before we get started, what best describes you? Are you brand new to the Medicare industry? So you're just starting off, maybe you recently got contracted in the last couple of months, or maybe it was your first AEP and you're just a little bit overwhelmed. I completely understand that. Maybe you're an active agent, but you've never used CSG before. This is always my favorite thing to see from agents, because after agents attend this training or any of our Medicare supplement training, they always say, how was I contracted in selling and not using your systems? Because they are blown away. Like, I can't believe I had this available to me and I didn't even know about it. This is going to make my life so much easier. Or maybe you know a little bit about CSG. Maybe you've used us for maybe just basic month subquotes, but you want to understand the full suite of tools that we offer. So just curious to know where you stand. And again, my favorite thing is working with either new users or new agents, because I really love showing them, again, the value that we are trying to bring you and really how we are trying to help you better understand the market, but also what carriers that are available to you in this space, and really help you sell efficiently. So I'm going to be walking through the tools here today that allow you to be a more informed, more efficient agent. So 28% of you, you're brand new. You're in the best industry that you can be in. I love this industry. I love all of our integrity partners. Any FMO that you are contracted with, you are completely in great hands. I love everybody here. 35% of you, you're an active agent, but you've never used CSG before. you're going to be those 35% that say, I can't believe I didn't know that this existed. So I love that. And then 39% of you know a little bit about CSG, but you want to learn more. So I love that answer as well. So thanks for answering that question for me. CSG offers really a full suite of tools for you in the Medicare space. So these are some different things that we offer at CSG. I know a lot of you received a personal email from me inviting you to this training because I saw that you were a new user. So I wanted to make sure that you knew. And I highlighted some of these things in that initial email out to you. But I'm curious to know what you are most interested in today. I always like to focus these live trainings for what my agents that show up need out of me as your trainer. So I will focus on what is important to you here. But again, we'll cover everything, just bits and pieces. Med Sup coding and EAP, ancillary, MA and Medicare Advantage with the hospital indemnity cross-out, Medicare demographics and enrollment data, and then market intel. So 82% of you are saying Med Sup coding and EAP. I love that because I also want to tease for you a webinar that we have this coming Thursday that's all about the Med Sup coding. So when I demo Med Sup coding today, I'm just going to be covering the surface of it. So you'll want to make sure that you attend Thursday or watch Thursday's recorded webinar if you can attend, because we're going to break down this entire coding tool for you and define what everything means. So those individuals, you want to be on Thursday's training. Ancillary quote, so being able to stack a Med Sup next to a dental, hospital indemnity, final expense plan. Our tool is great for that. I love the MA hospital indemnity cross-selling tool. It's called Fill the Gaps. This is the easiest, most efficient way to cross-sell. It really allows you to better explain it to your clients as well and show them the value. So I love to see that. So great results here. 57% of you are saying ancillary quotes, 55% the hospital indemnity cross-sell, 48% of you Medicare demographics and enrollment, and then 27% of you are saying market intel. So we'll cover it all, but we'll spend the most time on those, probably those first three, just because so many of you have said that. So awesome to note there. Okay, so when to use the CSG app? This is probably the most common question I get because a lot of you are using CSG through the Medicare Center and you're thinking, well, when do I use the Medicare Center system? When do I use CSG? So I always like to highlight here for you what I am recommending, and I am going to be demoing the tools that I'm recommending you to use, okay? And I'm going to kind of walk through, you know, at what point in the process do you switch to CSG versus the internal Medicare Center system, okay? So just overall, we are going to help you better understand the Medicare market. We're going to help you accurately quote and cross-sell, as well as grow your business with our Market Edge tool. So first thing I always recommend, if you have not subscribed to our newsletter, that's one thing I'm going to recommend off the bat to you, because we provide you so much market intel in our newsletter. So if you haven't done that, go ahead and go to csgactuarial.com. I'm going to pull that up here for you to see. Go to our Learning Center, and then click on the news section. So every Friday, we will send you an email that summarizes our market intel for the week. We do a lot of different articles on here, but some things that you should really keep in mind. We report all of the Medicare supplement rate adjustments in here. We have different quarterly reviews on some of these carriers. So when Humana reports their quarterly earnings, like they posted their fourth quarter results for Med Sup and Medicare Advantage, we will summarize for you how many people are enrolled in Humana's Med Sup block of business and how they grew with their policies. We'll do the same thing for the Medicare Advantage policies in force. So A lot of the major carriers will report these, so we will summarize all of those for you. And when they do, you'll automatically receive that email on Friday. So it's really nice to have that in your box. We'll also just let you know of different market trends as well that we're seeing, any type of acquisitions, what different carriers are doing. So there's a lot of great information in here, but I think that the key thing for a lot of you is just getting data on the rate adjustments, so our monthly rate filings, as well as these different quarterly reviews on here. So subscribe to that. It's a great way just to kind of stay in the loop with what's happening in the industry. And if you just subscribe to this, you're just getting the Friday emails. Okay, so the other thing that we offer and when to use CSG is our agent quoting tool. So you will use our agent quoting tool for your Medicare supplement quotes and your Medicare supplement e-applications. So you'll notice if you are using Medicare Center, you just have Medicare Advantage quotes in there. So that's where you will use CSG to do all your med sup quoting. You'll notice we quote 100% of the market in that tool as well. We do have some carriers that you can submit an application for right on our platform. So the headache of having to learn every single carrier's e-app and processes, we've removed that for you. So you can go straight from a quote into an enrollment right on one platform. It's the same look and feel for every carrier. We do have a webinar next week just on e-apps where we will demo that e-app start to finish for you. After you are done with that Medicare Advantage sale in Medicare Center, that's where you will then come into CSG and use our Medicare Advantage Hospital Indemnity cross-selling tool that allows you to stack your client's MA plan that you just talked to them about or just enrolled them in next to a different hospital indemnity plan option. So you can really customize a hospital indemnity plan to fill those particular gaps in their MA coverage. So that's when you'll use our tool. You'll also use CSG for your dental and your final expense. We make it really easy for you to stack a med sup next to a dental, next to a final expense for that easy cross-sell. We also have all of your Medicare demographics and enrollment data. So if you want to know how many people are enrolled in this particular med sup plan or this MA plan, our data, our quoting tool is going to be able to tell you that. So I'll show you here and highlight that for you. We also, within the quoting tool, will report those monthly rate change reports. As soon as I show you this, you're gonna say, I never scroll down to see where these are at, and agents love these monthly rate change reports. We also do carrier competitive heat maps that really allow you to see where a carrier is competitive at nationwide without you having to run several different quotes. It would take you over 2 days to run a quote in every single zip code for all of your carriers to see where they're competitive at. So our tool can quickly summarize that for you within seconds. I'm also happy to share with you that our MedSup consumer quoting widget, this is free for you. So if you have a website and you want to put MedSup quoting on your website for your leads or your current clients to run MedSup quotes, that's free for you. That's a free service that we provide to you because you are contracted through an Integrity Upline or FMO, okay? We also provide excellent training opportunities. I do not mean to toot my own horn here, but I'm telling you, when you attend some of our webinars, we go right into the market data. So we just did a webinar last month summarizing all the rate adjustments for every single carrier, every single state. Our webinars are designed to inform you, okay? We're not trying to sell you anything. We're not trying to get you to sell a particular carrier. We are trying to inform you of what we are seeing in the industry so you can make the most informed decision that you can make. You can then work with your uplines on proper contracting for carriers, okay? We don't touch your contracting whatsoever. I'm not gonna sway you any way in my webinars. I'm gonna inform you on what we're seeing in the market, and that's what I love about it. We do stay very unbiased in our trainings. And then all of this is free to you, okay? So we're having a webinar later this month just on Medicare Advantage enrollment data and what we saw during AEP. That's a free training that we're gonna educate you on market trends. So take the opportunity to attend these trainings, okay? They're gonna really help you down the road. Okay, so I'm gonna kind of switch gears here. I'm gonna get into more of what I call a demo. I typically don't like going through PowerPoint slides because I wanna show you where everything is at. So since I'm on the CSG website for now, I'm gonna switch to my Learning Center, and I'm gonna click on this CSG App Medicare Center. Because as I mentioned, all of the webinars that we do following today's is going to make sense for you. So today you're attending this new user training where I'm really introducing you to CSG and the tools. But after today's training, you're gonna wanna dive into each topic and spend a full hour just on that particular feature. So Thursday, we have our All About Med Sup coding where I'm gonna define everything that I'm gonna show you here in a little bit. Okay, then the following week we have just EAPs where we'll take you through an EAP start to finish. This is that Medicare Advantage enrollment data AEP reports. So I'm going to take all of the market intel that we have available to us here at Integrity using our data and Def Research, and I'm going to summarize for you what happened during AEP. I'm going to show you which carriers gained lives, lost lives. I'm going to show you what plans were most popular. I'm going to show you what benefits were most popular, how the dual D-SNP plans performed as well. I'm going to break down everything for you so you knew what happened during AEP and the switching that went on, okay? And then I'm also going to help you cross-sell. I'm going to help you cross-sell to those Medicare Advantage clients. So important to cross-sell, especially with that hospital indemnity plan to your MA client. So I'm going to coach you on how to do that. So join me throughout the entire month. I love being able to walk you through all of that. So if you are currently inside Medicare Center and you're thinking, I didn't even know CSG existed, where is CSG even at inside the Medicare Center? I'm going to go ahead and sign in here and I'm going to show you exactly where you need to go. So if you want to follow along with me, you're more than welcome to, but I'm going to go ahead and log into this particular Medicare Center account and show you where our CSG suite of tools is housed at. So you can easily access it here by going to your name in the upper right-hand corner and then clicking on this CSG app. Now, if you are using your Integrity Upline's branded quoting tools, you are still welcome to use those. I know a lot of those branded quoting tools are custom to that particular upline where it shows the carriers that they have contracts with or different carriers that you're able to write business with, because the Medicare Center version is going to show you 100% of the market. So if you would still like to use your upline's quoting tool, I'm not going to stop you there. I'm just going to be demoing everything in here for you. So when you first sign in here, I always get the question that if you are ever stuck in that loading, make sure that you don't have any pop-up blockers, okay? Because that will prevent you from opening up CSG in a new tab. So make sure that you don't have any pop-up blockers. We will always let you know of upcoming trainings or upcoming information that we feel is valuable for you to know in this little kind of top banner portion here, where we will give you quick links to attend webinars if you need to. From there, we have our entire suite of tools, which we're going to be covering here today. Some of our tools, you also have these similar tools for you inside Medicare Center. So I don't want to prevent you from using Medicare Center scope, but we do have a scope in here as well. But again, I'm just going to show you tools that I feel like that are going to bring that value to you. So we'll start going through these tools, and then let's scroll down to this market data, because this is something that even if you are using CSG regularly, you probably never scroll down, because I hear that from 99.9% of agents. So you need to move this market data up so you can see it. Monthly rate change reports. So hands down, we are the best MedSup quoting tool in the industry. And I'm not saying that because I work here at CSG. I'm saying that because I have seen and utilized the other platforms. And nothing compares to what we provide you. I think the value that we bring is we're also not biased. So we are going to show you exactly what is happening in the market for every carrier. So these monthly rate change reports will tell you for each particular company what they are taking rate adjustments for in each state, when that rate adjustment is effective, and the different percent for each particular plan type. So this is a great way for you to track the carriers that you are writing, maybe what they are doing in other states, but also just what we're seeing as far as market trends. So we did that rate adjustment summary for 2023, which was really powerful, and a lot of that is captured from this data. I will tell you, we have all of this in Excel files as well. So if you need rate change information on a certain carrier, email me. I am happy to share that information with you, because we can share that information with you, but we summarize it here for you each month. So you know exactly what different carriers are doing by state, again, plan type, and the different percentage. Now we document this for you in the quoting tool as well. So I'll show you where that's at. But again, this is available to you, okay? I know agents love it. It's always one of those, like, with carriers, if you go and you email a carrier, can you share your rate adjustment? It's always, you know, you never know what you're getting. So we show you all of the open blocks of business. We do not track closed blocks of business. And if I just said closed block of business, you're new to MedSup and you need to attend that training on Thursday. So I'm going to give you high-level overview of our MedSup quoting tool. I know over 86% of you wanted to see this. So again, I'm going to do high level for you here today. CSG, we do have a client manager system where you can import your clients, but I'm going to stop you there. I don't want you to duplicate your work. So if you already have your contacts loaded in Medicare Center, keep them in Medicare Center. CSG and Medicare Center, our contacts do not talk to each other, but you do not need to have a contact created to run a quote. I think that's another reason why a lot of agents will use us for quoting purposes, because you can evaluate the entire market without having to enter in a bunch of client data. You maybe just want to run some quotes, okay? CSG is perfect for that. So enter in a zip code. You'll then see the county. You can then adjust the age, gender, tobacco status, how you want to sort by. I know some of you want to sort by that AM Best rating. So if you want to sort by that, all the power to you. Again, if you don't know what an AM Best rating is, you'll want to join me on Thursday. You can then change the plan type as well. So we default to G, but you can quote any of the plan types in the system. Always move your effective date forward. As you saw in that rate change report, we already have March rate adjustments loaded into the system. We get all of our rate data directly from the insurance carriers. So sometimes it will vary from carrier to carrier on when we will get those rate adjustments. Some are great where we will get that a month to 2 months in advance. Some it's 2 weeks. Some it's that day. We do respect our relationships with the carriers and providing that data to us. So if we don't have a rate adjustment for April loaded into the system, just understand that it is coming when the carrier allows us to display those. If you want to include household discounts, you can do that here as well. And then we do have advanced underwriting filters. So if you have a client that's going through underwriting, you can enter in health conditions and medications, and we will remove those carriers that have those knockout health conditions and those medications as an automatic decline. So that's optional for you. But again, just running your quote, entering that client zip code, and then adjusting the demographic information. Secondly, we're going to show you 100% of the market. So we do not check any of your contracting, who you're contracted with. The only thing that we will validate for contracting is when you try to do an e-application, okay? So you'll get this nice pop-up letting you know which carriers we do have available to you on the e-app. You can just hit this OK button. So any carriers that we do have EAP capabilities for, you will see this apply now and add to cart option. Again, we don't check or populate these buttons based upon your contracting. So once you hit this apply now button, that's when it's going to ask you for your NPN or your writing number. We validate you in real time with the carrier. As soon as you pass that validation, it takes about 5 to 10 seconds. Then we put you into the EAP, okay? And all that EAP is done on our system. When you are reviewing the quote results page, you can always quickly make adjustments here so you don't have to start a brand new quote. But we're going to define a lot of things here for you. And unfortunately, I don't have time here today to explain what all of this means. So that's why I'm going to recommend you join me on Thursday. But we'll always show you if a carrier has a household discount, what that percentage is, and we'll define for you if it's a multi-insured or a roommate discount, or if they offer both types of discounts. So a roommate discount being if they're living with somebody over a certain age, they'll get that 7% discount. A multi-insured, this means that they, both husband and wife or both people living in the household have a policy with that carrier. And some carriers like Allstate, they'll offer both. So you'll get a household discount. One just may be higher if it's at multi-insured versus roommate. We'll also define for you their AM Best ratings, any type of rating classes. So we have gotten so many questions on what's a rating class? What does wearable mean? What does preferred mean? Will my client qualify for that rating class? So we now have those rating class definitions for you. So if you want to know what Allstate wearable is, click on that rating class definitions and this nice document will pop up. And this will define for you all of the rating classes and what the eligibility is. So we have this broken out here for you based upon company in alphabetical order, and then the rating classes, and then the definitions as best as we can. So a lot of these preferred rating classes, they do have height and weight charts. So we don't have the exact height and weight chart in there. So that's where you'll have to reference that that particular carrier site for the exact chart, but we'll define here for you as best as we can summarize these different rating classes for you. So that's a great resource. We also have the Choosing the Medigap Policy Guide, where this defines for you a lot of the attained age, issue age, community rated definitions that you do see in the tool. If you want to apply household discounts, you can hit that apply household discounts over here on the left-hand side. So now any rates that you are seeing will include that household discount, whether that's 7%, 12%, up to 20%, I've seen for some carriers. Annual rate instead of monthly rate, that's an option here for you. Market analytics, wow, I could go all day on market analytics. Let me just kind of summarize a couple of things for basic purposes with this market analytics. First and foremost, if it is an attained age plan, meaning the rate is going to increase as they age, we will define here for you how that rate will adjust based upon their age. And this is if no rate adjustments take effect. We'll also show you the increase history. So if a carrier has taken a rate increase or rate decrease for this particular open block of business, we will define that here for you in the middle column. If it says NA, that means they have not taken a rate increase, okay? So you'll see what that rate increase history is. And then market data, this is their lives covered. So each year, companies have to report to the NAIC, the National Association of Insurance Commissioners, their lives covered, their premiums, their loss ratios, and their market share. So we will define all of that here for you in the quoting tool. It's a lot to go through. So again, that's why I keep teasing Thursday, just because we're gonna cover all of what all this means in Thursday's webinar. We just don't have enough time in this intro, okay? So again, you see 100% of the market, you can do as much quoting as you want. Now, one tool that agents love in our system is our comparison tools. So we have two compare options over here on the left-hand side. We have compare quotes, which allows you to stack multiple Med-Sup plans side by side. So if you want to stack a G next to an N or a male rate next to a female rate, you can compare as up to 5 plans side by side. The universal compare tool. This is going to allow you to stack multiple products side by side if you wanted that cross-sell opportunity. So for Med-Sup, for an example, if I click on this box with a check mark, it says compare. I can go ahead and click on that. The bar then turns green and it puts that plan into my compare quotes box on the left-hand side. So if I am sitting down doing a comparison with somebody, or I wanted to print something off ahead of time, this is a great way for you to do that. So you can see that I can put G's in here. I could switch this over to an N, or go from a male to a female, adjust the age, and then hit get quote, and then put those other plans in there. So the compare quotes is just for Med-Sup or that particular product. The universal compare quotes, this is going to help you with your cross-sell. So we'll touch the globe icon instead. As I hover over that, it says universal compare. It then turns the bar purple. So now it puts this plan in my universal compare quotes box. The universal compare quotes would allow you to put a Med-Sup next to a dental, next to a final expense, so you can present a full portfolio. You could even add a PDP plan in there if you would like to on our system, which makes it really great to present different plans and different carriers in one nice print off. On the Med-Sup side, you do have exporting options if you want to export all the raw data into an Excel file and do anything that way, or export the entire quote results page into a PDF. You absolutely have those particular options. So if I wanted to then take this compare quotes box, all I would have to do is click on that compare quotes box. It puts these two plans side by side for me, where we are going to define everything here for you. From there, you will go ahead and hit this PDF option, and you'll have a nice PDF comparison. Now, one thing I do want to point out, if you want to include household discount percentages and rates, make sure you have that apply discount selected in there, because like you'll see in this Allstate and Humana, the household discount percentage says 0, and that's just because we already applied it. And we have a very unique uploading process for some of these carriers that I won't bore you too much with developer and IT jargon, but just make sure if you want to show a rate with a household discount, you hit apply discounts to include that premium, and then you hit that compare box. Universal compare quote. So let's say I want to go from that Med-Sup and I want to add a dental and a final expense. I have my plan in that particular universal compare quotes box, and I can just go right back up to the top here and hit on dental vision, and then I would be able to run my dental vision quote. And then once I'm done running that quote, I can put that particular plan into my universal compare. So dental's really easy. I think any quotes on our system, as long as you can type in a zip code and adjust the demographics, you will be fine here. So just go ahead, enter in that zip code, age, gender, tobacco status. Now these product filters, if you just wanted to do a dental or just wanted to do a vision, you can remove the vision from it and just see dental plans. If you want to incorporate plans that are maybe standalone dental, standalone vision, plans with dental and vision, plans with dental, vision, and hearing, just leave the product filters there. So that way it pulls up all of the different plan options for you. Just note in this particular system, you'll have to kind of scroll through some of those individual plans to get to the plans that incorporate all of the different benefits. So again, the layout is the exact same on the system. We also have the dental available for e-apps for certain carriers. And that's where you'll really start utilizing that add to cart option, because what the add to cart allows you to do is do a Med-Sup next to a dental application in one process. So that's where you have, think of it as like an Amazon shopping cart. You're picking your meds up, you're picking your dental, different carriers, different shops, but you're going to go through one checkout process. So I love that kind of component, and that's why you have that add to cart. But if you're just doing a standard MedSuppy app or just a dental, you can just hit that apply now. So to see the benefits of these plans and what's included, just click on the quote options and then view plan details. This will highlight here for you all of the benefits of that particular plan. So what's included with the dental, the vision, and the hearing. So once you have selected your plan, again, just hit on that globe icon there, turns the bar purple, and then it puts your plan in your universal compare quotes. So now I have my plan G with Allstate, I have my dental with Aflac, then I can come in here and maybe I want to add a final expense. So what we're really trying to help you do here is be efficient in your quoting processes, because I could have spent a whole hour going to Allstate's website, going to Aflac's website, now going to run a final expense and having a different quote on different websites. We're letting you do everything in one system together. So it's going to make it a lot easier here. Enter in that zip code, age, gender, tobacco status, face value amount for final expense. We do default to 10,000. If you want to adjust that, you absolutely can. But here's what I really like about the cross-sell, because as you're getting into that get to know you session with your client or that needs assessment, one of the things that you may be asking is, what is your monthly budget? What do you have set aside to pay for your health insurance, your life insurance? What are you currently paying today? And once we've figured out, okay, for your MedSup and your dental, you have X amount left over now. Let's just see what we can allocate towards a final expense plan. So maybe that's $30, maybe that's $40. You can type in a monthly rate here and then quote based upon monthly rate instead of face value. So we're trying to provide you different resources for being efficient in that quoting and allowing you that cross-sell. Product type, you can select any product type. You can also select all to incorporate all product types. If you wanted to find guarantee issue plans versus fully underwritten plans, you can adjust there and then go ahead and hit get quote. So I won't spend too much time on the final expense. I just want to let you know that you do have that option to run final expense on here. So if you are an agent that is doing your final expense quotes with your Medicare supplement clients and you want to do these comparisons, this is a great way for you to do that. We do show you all of the annual fees. So if you want to apply those annual fees to the monthly rate, you can click on apply fees on the left-hand side. And then again, once you find your plan, go ahead and click on that universal compare, the globe icon, and now your plan is in there. From there, you can click on your universal compare quotes. Now I have those 3 plans side by side. Michael, you asked the question, can we check providers for dental? So we do have underneath the view details, that button or quote options, there's a link to the carrier website. You will have to go to the carrier's website to check those dental providers and the networks. So now I have those 3 plans side by side, okay? Easy peasy with your cross-selling. Let's get into Medicare Advantage. I'm going to try to kind of speed up here and go through, again, the tools that a lot of agents wanted to see here. So I'm going to use our new Medicare Advantage tool. Now, what I want to tell you, and this is where I don't want you to duplicate work, okay? I want to make this simple for you. So you will use Medicare Center for your Medicare Advantage quote, enter in those providers. You're going to use it for your enrollment. So I want you to stay on Medicare Center for your MA and PDP quotes and EAPs. What I want you to use CSG for is your cross-sell, okay? I want you to use CSG for your cross-sell for hospital indemnity. And this is how you do it. The other thing I want you to use CSG for is your market data for MA. So if you want to know how many people are enrolled in certain MA plans, this is what you're going to use, okay? Those two reasons. So go into our newer version. There's no reason to use our older version. Go into the newer version, and all you have to do is enter in that client zip code. Again, I don't want you to repeat what you're doing in Medicare Center. So enter in that client zip code. You can adjust the plan here if you needed to. We're going to leave it on MA because we're doing that MA cross-sell. And then show drug costs, you can go ahead and enter no, just because we don't need drug costs for doing that hospital indemnity cross-sell. So go ahead and hit get quote. This is also going to show you 100% of the market. So this is where I really like agents that may be working with a client that wasn't their client previously, and then come AEP, that client was not happy with their current insurance agent. They're now working with you. Maybe you need to pull up their previous plan. This is a great way for you to do that because you'll have access to 100% of the market. Or get this, I see it all the time. You're not their agent of record for MA, and now their agent is. But you're going to be the agent that goes in and sells them hospital indemnity. Okay, so I've seen that too. I love that. I love that spin on things, because then the next year they'll be your MA client, promise. So the thing that I really like about our MA tool is if I click on show plan highlights, this is where I'm going to start being able to view that demographic information and enrollment history. So keep in mind, we're going to be getting, let me make sure I can get some of these in here. I may have to do an old plan for now. Let me try one more plan. Okay, so some of these, we're still getting all the enrollment data for January into the particular system. But what this is going to show you is for each month, the Medicare eligibility. So in this particular Dallas County zip code that I ran, how many people are Medicare eligible? Out of those that are Medicare eligible, how many people are enrolled in MA? So if you want to understand your penetration in the areas that you serve, this is one way that you can do it in our system. From there, we'll tell you how many people in Dallas County, out of those that are enrolled in an MA plan, 7,200 are enrolled in this particular Cigna Healthcare. And then out of that, over 1,500 are enrolled in this particular plan. So this is really great. And I love that we already have the January data in here, because we can now start comparing December to January. Okay, and where these switchers happen, which we're going to summarize all for you later this month. So this is a great way for you to see the enrollment data, how different carriers and plans are performing, and the penetration in your area. So let's say I'm going to go through this kind of scenario here. I used Medicare Center. I did my MA quote, my enrollment. Now I'm going back to my client here in February. Hopefully you already did this in January, but now you're going back to your client to talk to them about their gaps in their coverage. Maybe you did that during, or maybe you're doing that during that initial sale because they selected hospital indemnity on that scope of appointment. So come in here, find their plan that you just used Medicare Center to quote, and then click on View Plan Details. We can go into the benefits and the cost, and then we can start scrolling down and we see this inpatient hospital stay. So I know for days 1 through 6, my client would have to pay $250 a day. So to use that Fill the Gaps tool, all you have to do is come up here to the top and click on Fill the Gaps. It populates their zip code. You can then adjust the age, the gender, and the tobacco status. Then go ahead and hit on Search Quotes. Now again, we're going to show you all the different options for you for hospital indemnity. So you may not be contracted with all of these different carriers, but it allows you to see that and then talk with your uplines about contracting. What I really like about this is we can stack multiple plans alongside each other as well. So if I wanted to compare a 5-day to a 6-day benefit, or a GTL next to a Medico plan, I can do that with this tool. So again, I needed days 1 through 6. So I'm going to find plans for that 6-day benefit for my client. Maybe I wanted to pull in Liberty Banker 6-day benefits. You have a lot of options here for these particular carriers. If you want to do the GTL has a 4-day option, maybe a 6-day option with Medico. Again, go through and select which plan. So I'm going to select a Medico and a GTL, both 6-day benefits. The price here on the left is the base amount of $100. We're going to adjust that here in a second. So select your plan you want to stack that next to, and then you're going to see your client's MA plan next to these 2 hospital indemnity options. So this is where I'm telling you, and I guarantee this is going to help you explain to your clients the value of that hospital indemnity plan, because we're going to show them right here on the left their gaps in coverage and how that hospital indemnity is going to fill that gap. Okay, so for days 1 through 6, $250. I will then come in here and I will start adjusting my value amounts. Okay. We do a lot of coaching on our webinars on how to cross-sell this and the different strategies that we can do on here. Unfortunately, I don't have time to go through all of that today, but again, later this month we will. Or if you want to watch some previous webinars that we did, we do a good job at coaching you on this. But from after you select your benefit amount, you can scroll down and now you can start seeing all those ancillary riders. So this is your bulk, right? Your hospital confinement. Everything else is going to be your additional rider. So your outpatient, do they need that surgical rider? You'll be able to see all of the options and the costs for those. Skilled nursing, rehab. You can look at this emergency room. This is automatically included in it. Ambulance rider, always a popular option, the most added rider that we see on these hospital indemnity plans. And then we can continue scrolling down. A lot of these companies are doing a lot of cancer benefits, dental, vision, and hearing benefits, critical illness riders. So they're being very, very unique on some of these riders that they are offering. So you can really customize it to what the client needs and their health coverage and where those gaps are at. So now I have a nice comparison. I can talk my client through. When you're done with your comparison, you can come up here and you can print and save it, export it out to a PDF. So that's a great way for you to do those comparisons. All right, one last thing I want to show you here today is our Market Edge tool. And then we'll kind of wrap up today's new to CSG training. Just keep in mind all of these services that I'm showing here for you. I think we had some people join a little bit late with some of the questions. All of this is free for you to use, okay? So there's no cost for you to use this. Again, if you're in Medicare Center, all you have to do is click on your name in the upper right-hand corner and go to this CSG app. Okay, that's all I'm going to repeat because I don't want to waste anyone's time here, but I think I had a couple people join me last minute. Market Edge tool. Okay, so Market Edge does 3 things. I'm going to just show you one option here today because I think it's the most valuable. Market Edge is going to tell you by state and by zip code how many people are turning 65, over age 65, on a Med Sup plan versus a Medicare Advantage plan. There's some other great features of Market Edge. That's just one, okay? So I'm going to show you how that works here. I'm going to say I am an agent that is kind of looking to expand my book of business. I'm looking to grow and get licensed in other states, and I just need to figure out where I should be focusing my marketing dollars at or where I should be buying leads at. So let's just say I am an agent in Texas, but I'm going to start selecting some surrounding states. I really want to look at my opportunities. So I initially selected like Arizona. I'm also going to look at Oklahoma, and let's just do those 3 states, okay? From there, I'm going to just hit run search. We do summarize all the quoting data in our system, but I just want to show you one component. So go into Market Edge and just select your state or your states that you're licensed or interested in. If you wanted to run a national map, you could absolutely do that as well. But again, what this tool is going to show me, it's going to show me these 3 states. And I'm going to be able to start drilling down into 3- and 5-digit zip codes, the Medicare demographics. So I'm really going to be able to understand, given this certain area, where are we seeing the most penetration? Is this a more Med-Sup area? Is this more MA? Is it a good equal mix? How many people are turning 65? Where should I be doing my Medicare 101 seminars based upon where there is the most individuals maybe turning 65, or if I'm a strong MA agent, a strong Med-Sup? I hope you're a strong both, right? I hope you are going through that needs assessment and really figuring out, is an MA or a Med-Sup better for you? But this really allows you to see what the demographics are in your given state or your particular area that you are servicing. So I have Arizona, Texas, Oklahoma. As I hover over a particular state, it's going to summarize what we saw for quotes in the last 30 days. I didn't touch any of that data. You're always going to see more Med-Sup quotes in our system just because we are Med-Sup heavy and agents utilize Medicare Center for their MA. Population over age 65. So I know there are 3.9 million individuals over age 65 in the state of Texas. I know there are 23,000 individuals that are turning 65 in the month of February, okay? I also know how many people are on a Med-Sup plan and how many people are in an MA plan and that penetration difference. So I can now zoom in to the state of Texas. It's a big state, right? So maybe if I'm located in Dallas and I want to start expanding into other areas, I can now go in here and check out the Austin area, check out the Houston area. Maybe I want to go more suburban or rural. I can really narrow that those parameters down. So we can heat map this. So right now it's filtering out by Med-Sup quotes, but on the left-hand side, if I want it to show me by zip code, which zip codes have the most people turning 65 this month, I can hit on that icon here. Oops. And now I know which zip codes have the most people turning 65, okay? As I hover over those areas, you'll see my numbers change. This area is more MA than Med-Sup, okay? You won't see that in every single area. So the more you get into this tool and utilize it, you will find pockets where it's more Med-Sup versus MA by 3 or even 5-digit zip codes. We can zoom in even further. So now we want to go into a 5-digit zip code, and I want to see population turning 65 this month. So there's 16 individuals in this zip code that are turning 65 this month. I know my Med-Sup versus my Med-Sup policy holders, Med-Sup versus MA, but we're also now bringing in that median household income. So you're probably thinking, how will this help me, right? This is a lot of data. How is it going to help me? One is it's going to help you narrow down where your focus is going to be. If you're one of those agents that are doing a Medicare 101 seminar, you want to make sure that you are hosting those in areas where you're going to get the most bang for your buck. Because we know that seniors or people that are over age 65 are not going to travel clear across town for your seminar. They're going to stay within their pocket, their community, where they feel comfortable being at. So you can utilize this to find pockets where you may have a higher turnout. Or if you are, again, looking for more of that Med-Sup client, you're going to want to make sure that you're focused in on areas that may have a higher median household income. We see people with a medium higher income on a Med-Sup versus an MA plan. And what I really like about this tool too is you can drill down, so you can zoom in. So if you see that this area has the most people and now you're thinking, where could I hold my event? We're utilizing Google Maps here. So, hey, if you want to host it at that Funplex, all the power to you, right? Or if you want to host something at a library or a restaurant, this is how you can also utilize it to see where things are located too. If you now want to go in here and say, okay, I found these pockets where there's a high over age 65, a high turning age 65, I'm now going to take this data, I'm going to go into Integrity's lead center, and I'm going to purchase leads in this zip code or this county, or I'm going to set up real-time call campaigns so I can start capturing these individuals that may be shopping for insurance because they're turning 65. So utilize this as a resource to make more informed decisions on where you're sending your marketing dollars, your leads, your advertisements. Or hey, you're located in Texas, but you know what? I want to really expand into Arizona or Oklahoma. The carrier that I do business with has really, really competitive rates in Oklahoma, and I know they're competitive in certain pockets. So I'm going to go in here and see what my areas of opportunity are in my surrounding states. Does it make sense for me to get licensed? So there's a lot of great opportunity for you to really better understand the areas that you serve, but also expand your reach and make more informed decisions, okay? This is a great way, great way for you to do that. John, you have a question on best place to keep your overall client information. You need to keep your client information in Medicare Center. So I recommend you keep all of your client data in Medicare Center. Medicare Center is going to be your CRM, your contact management. You're going to use CSG for your MedSup quoting, your MedSup e-apps, your ancillary, and your market research, okay? That's what you're going to be using CSG for. Any of those cross-selling opportunities with that hospital indemnity, your MA, but I want you to keep your clients in Medicare Center because there's so many incredible things that we are doing within Medicare Center from a contact management piece. Kind of long story short, we do service other agents outside of just Medicare Center agents, which is why we do have these different tools. We do have some other features of Client Manager like bulk MedSup quoting, which we utilize Client Manager for. So if you buy a ton of leads and you want to import those leads into our Client Manager to do bulk quoting, that's an option. I don't really do too much on bulk quoting. I want to because I think it's really, really cool and effective, especially if you're purchasing leads. But that would be my question for you. Don, the turning 65, so that's 65 this month in February. So we always post the current month. I know that a lot of you are doing your T65 3 months in advance. I know that. I also know that the data does not dramatically shift month to month. And because we are not giving you the names of the individuals, you can still use the data to then maybe use a system where you can go in and purchase who these people are, or go do your door knocking, or go into lead center. So that's where I want you to make sure you're setting up successful campaigns in lead center by knowing the data first. And you're going to get that data for you in Market Edge, okay? All right, so we only have a couple of minutes left. One thing I want to touch upon, actually it's time, so this goes fast. Support. Always contact us for support. So you can either call us directly, you can always send us an email if you would like to at info@csgactuarial.com, or you can send a message in here. Just make sure that you have your email here, your phone number, and then you can send your message to us. We will reply likely within 30 minutes to an hour, or really, really quick. Or you can go to our website, csgactuarial.com. Our phone number and our email is up there on the left-hand side for you too, okay? So keep that in mind. I want to see you on some more trainings, okay? I want to make sure that you are fully utilizing CSG. I showed you a very small portion of CSG as an intro, and a lot of you are probably thinking, gosh, that was a lot for an hour, and I understand it was a lot, but keep in mind, I could have spent an hour on each topic. So that's where I'm going to encourage you, especially who wants to know more about MedSup coding, to join me on Thursday. And if you can't join me, register anyways, just to receive the recording afterwards so you can watch it at any time. Okay. Any last questions? I will stay on. I know I kind of went through and answered some of them as we went along. We didn't have too many questions, which I like. Becky, you can quote dental and vision for a client who already enrolled in a G. Absolutely, you can write a dental at any time. Cheryl, Cheryl, you asked if a client wants a dental and is going with Allstate for MedSup, do they have to stay with the same company? No. You can do a Humana dental if you wanted to, a Medico dental, an Emeritus dental. They do not have to stay with the same company. And that's where that universal compare tool is awesome, because you can stack different products with different carriers. You can quote any state you want to in the system. That's also a really great benefit in the system. Rebecca, you asked, why do some quotes not match up with Medicare.gov quotes? That's a really interesting question, because we actually power Medicare.gov MedSup coding, so it should match. The only reason why it may not match is if you are applying discounts or if you're doing a different plan type, but we actually, I'm very proud to say it, we do power Medicare.gov's MedSup coding. So if you see something different, go ahead, send us an email, we will explain to you why. When I tell you that we are the leader in MedSup quotes, you know we are when we power Medicare.gov. Current MAPD. MAPD is complicated. So whether you're doing an MAPD on a carrier's website, Medicare Center, CSG, your plan should all be the same, but your cost of your prescription drugs may vary. And that's just because how the data for prescription drugs can be sourced differently. And they're always estimated averages. So that's always your cost of your prescription drugs may vary from site to site. Okay, so question about when I see companies we are not contracted with, do we just contact our FMO to request the contract? Absolutely. You can just, if you see a particular carrier that you want to get contracted with, first and foremost, reach out to your Integrity FMO or upline. If that particular upline does not hold that carrier contract, they may know another integrity company that does, or an FMO, or they would work with getting that particular contract. Or maybe they'll say, hey, here's why I don't recommend that particular carrier. There's a lot of different components that come into play. Okay, well, that is all the questions that I have here for me. Again, I want to thank you all for your time. I'm going to launch a survey here just to close out, let me know how you thought today's training went, if you think you'll be utilizing CSG, what features you really liked, and go ahead and provide any additional feedback that you may have either on CSG or on the training itself. I love being able to hear your feedback. I know the only way that we can get better is by hearing your feedback. So I always welcome it. Again, thank you so much. If you need anything from us, you can always send us an email. That info@CSG Actuarial is going to be your best option, quickest response there. And if you go to this in Learning Center, CSG app, Medicare Center, this is where you can attend our additional trainings. But we also have all of our previous trainings here as well. That one that I mentioned that I have agents asking me about is the rate adjustment one. This MedSup rate adjustment analysis webinar right here. This is where I went through and I went through the entire 2023 and I summarized what we saw for plans, for states, for carriers. So that's a great webinar to watch if you want to know more about MedSup rate analysis. That hospital indemnity cross-sell with GTLs on here as well. EAP training if you need it. So you can always load more as well to see some additional trainings that we have recorded. So again, thank you so much. We'll see you guys on our next training. Have a great rest of your day and a fantastic week if I don't see you later on.